Hi, Sean. It's Alice. I know we have other people joining too. We have a new colleague with the coalition who would works with us and would like to listen in. Is that something possible? I don't have a link I can share because I just have a speaker link. So I don't know if somebody from CSG can chat in a general link.
Sure. Yeah, we'll send it to you. Hold on just 1 second here. Let's see.
Hey, Jana, good to see you.
Hi, good to see you. Sorry I'm a couple minutes late here.
No
Wasn't
worries.
sure who all was in the room.
Thank you very much for that link. Appreciate that.
Oops. Hey Trey, can I record on my end as well?
I don't think so. It's just on my end.
Okay, that's fine. Okay, I think I'm ready. If everybody else is ready. Cool. Let's go ahead and let everybody in. Great. Well, hi everybody. We're going to go ahead and get started. I want to welcome everybody to this the second meeting of CSG's National Long-Term Care Workforce Network. I'm Sean Sloan. I'm a senior policy analyst at the Council of State Governments here in Lexington, Kentucky. Here's what we plan to do today. If I can get it's moving. After a quick introduction and project recap, we are going to dive into our main task today, which is learning more about the great work of the Moving Forward Nursing Home Quality Coalition. We will be joined by Coalition Chair Alice Bonner, one of the co-chairs of the Coalition's Workforce Committee, Jasmine Travers of the New York University College of Nursing, and Jenna Killerman, who is Director of Workforce Strategy and Development at Leading Age. We will turn to your questions and comments then. I'll tell you about our next network meeting coming up next month, and we will wrap things up for today. Just a quick reminder of how we got here. Last year, with the support of the Commonwealth Fund, CSG put together an 8-state interbranch task force of state policymakers that convened multiple times over the course of the year and advised us as we put together the CSG Long-Term Care Policy Guide. My colleague Asia, if she's on with us, will post the URL in the chat so you can bookmark the page to read later if you haven't done so already. By the way, as we said last month, we hope the Zoom chat will become a conversation unto itself here, with you all sharing your own reports and resources or connecting with others working on these issues. So feel free to ask questions early and often in the chat. One of the three focus areas that we had for the project last year was revitalizing the direct care workforce and supporting family caregivers. And in the policy guide, you'll find a number of strategies states have deployed to address those issues in recent years. So that focus now is the jumping off point for a new project for 2023. We are pleased to again be working with the Commonwealth Fund to build on the work we did last year. This project includes using the model for last year's 8-state task force to create a national long-term care workforce network, which you are now all a part of just by attending this meeting and choosing to engage with us on these issues. We're working on building a new website, a national online resource center that we hope will become a clearinghouse for all the relevant work being done on long-term care workforce policy around the country. We hope our network members will share relevant legislation, policy reports, and other materials that we can post to the website. It will also be a digital visualization and extension of the policy guide, where you'll be able to click on one of the state strategies on long-term care workforce needs from the policy guide. Let's say increasing compensation and employment supports, or improving data collection, and see what states are doing in those areas. So that is coming soon. We also, with this project, have the opportunity to provide technical assistance services for up to 5 states. If you believe policymakers in your state could benefit from a detailed briefing on how they might take action to address long-term care workforce needs, please don't hesitate to get in touch. So we were very excited a few weeks ago when Alice Bonner reached out and complimented the work of CSG that we've been doing in the long-term care space based on what she had been hearing from colleagues. And since then, we've had several opportunities to share the virtual stage, if you will, and give presentations on our respective projects to different audiences. I knew from some of our conversations last year with various folks that Leading Age and other organizations were working to advance the goals outlined in a 2022 report from the National Academies of Sciences, Engineering, and Medicine. But it has been great to hear about how the Moving Forward Coalition has come together and what they are working on, particularly to advance the goal of ensuring a well-prepared, empowered, and appropriately compensated workforce. We are excited to be able to share more about the coalition's work and what state policymakers should be able to glean from this effort. We're pleased that Alice is joining us today. In addition to being the coalition chair, she is the senior advisor for aging at the Institute for Healthcare Improvement. We're also joined by Jasmine Travers, who, in addition to co-chairing the coalition's Workforce Focused Committee, is also an assistant professor at the New York University Rory Myers College of Nursing. And Jenna Kellerman, a member of the Workforce Committee, who is also the Director of Workforce Strategy and Development in the Washington, D.C. office of the Leading Age LTSS Center at UMass Boston. A very complicated title, but Leading Age, which represents nonprofit aging services providers and other mission-driven organizations serving older adults, is one of the founding organizations of the Moving Forward Coalition and is acting as the coalition convener. Hopefully I have successfully identified all of the various affiliations, but please feel free to correct or amend as needed. Thank you all for joining us today. Alice, please take it away.
All right. Well, thank you so much, Sean, and welcome everybody to the call. We're delighted to be with you today. I'm going to just give a brief, maybe 10-minute or so overview of the Moving Forward Nursing Home Quality Coalition, and then turn it over to my wonderful colleagues who are really focused on the workforce efforts, as many of you are. We are deeply indebted to what you are all doing out in the world, in your states and your organizations every single day. The Moving Forward Coalition is a group that has come together, a group of organizations and individuals, all of whom are working on quality of life and related issues with residents of nursing homes. And hearing the voice of those residents is absolutely front and center for us, as it is for many of you. So next slide, please. The Moving Forward Coalition is a group of, as I said, of these different organizations, and we are funded by the John A. Hartford Foundation. We were given funding for 2 years to take the National Academies report that Sean just talked about, to go through that 600-page report and find the priorities that we thought were most important in the recommendations, and then take those priorities and research them and turn them into action plans that we will hopefully, we plan on testing a lot of those action plans in the second year of our work, which is going to start on July 1st. We're not going to be able to test all of it because some of it is more policy related, and you'll hear a little bit more about that. But in many cases, there are things we can do right now and start doing. So that's where our focus is. Next slide. So here is our vision and our mission. And our vision is that every nursing home will be a community in which lives are nurtured, residents are empowered, and where people want to work. And our mission, or how we'll get there, is that we'll make meaningful changes to policy and practice through the power of bringing diverse voices together now. And that word now is really important, and the word diverse is really important, and the word power is really important. We can't do this alone. None of us can. And some of us, like myself, 40 years doing this work with nursing homes, we've been doing this a long time, and it's way past time for some of these things to change. And a lot of it sits within, those of you and those of us who in the past, had roles in state government, in departments of health, in the federal government as well. So this is work we can do together. And we're going to, we want to be accountable for doing this work. Next slide. The NASEM report, again, the overview is that, people need to receive care in a safe environment, but one that honors their values and preferences. So, again, looking at equity, looking at disparities, we don't want to do anything that would increase disparities. So we really have a work group that's just focused on looking at every action plan to see, have we considered equity? Have we thought about disparities? So those things are really important. Next slide. So, again, the basics of the NASEM report, these are the basic goals, the categories of goals. And what we did when we set up the coalition was we said, we're going to map our committees so that each of these 7 categories of goals has a committee working on that goal. So, we have 7 committees. Each one has 2 co-chairs. There's probably 10 or so members, give or take, to each of the committees. We also have a steering committee, which has 10 or 11 members, and that group meets every month. And they really help to guide and mentor and make sure that the action plans we're developing are coming together as a set, an integrated set. So that's going to be work that'll be publicly shared probably sometime in July. Next slide. So we put the vision and mission and the priorities on our website. And in the month of December, we asked for any feedback from anyone in the public. So this was on our website, public document, and we said, please tell us what you think. And these are the 4 focus areas that people wrote back to us and said, these are the areas we think are particularly important. So resident-directed care or person-centered care, that there is an entire committee that's focused on that. And again, their priorities are looking at goals, preferences, and priorities, and asking questions about that when a person comes into the nursing home, they're newly admitted and with a change in condition. You're going to hear a lot about workforce, so I won't say anything further about that. The finance committee is talking to lenders, and we're talking to HUD, Housing and Urban Development, about loan guarantees and the HUD 232 program. I suspect many of you are very familiar with that or work in that program. And so, how can we use that to figure out where we can strengthen any sort of funding related to the physical plant or renovations of buildings? And then the accountability came back to us as something people said, we want to know when nursing homes receive funding, where does that money go? What's spent on resident care? What's spent on salary and benefits? Because, people are worried that money would, maybe be taken out of the nursing home or away from resident care. So the accountability for that is an area people asked about. So those are just 4 of the areas. There's other details that we're happy to share with you as well. Next slide. This is just a description of our journey along the way. So we convened our working committees. We went through the prioritization that I described, and currently we're developing the action plans. And then starting in July, once the action plans are approved by our steering committee and publicly shared, that's when we'll start to get into the testing. And when we say testing, we mean prototyping. We mean very small tests of change, like maybe with 3 nursing homes, for example, just to say, what would this look like in real life implementation? What would be the barriers or challenges? What would be, the outcomes that we would look at? What would be the evaluation strategy? Talking through those kinds of things in the steps toward larger scale, implementation and testing over time. Next slide. So again, in this, sorry about the formatting there, but we're trying to pressure test, as I just said, what these practice and policy levers would look like. And we also want to continue to build momentum. We get emails every week from people who want to sign up. We have over 900 individuals and about 150 nursing homes and lots of other organizations, advocacy organizations, QIOs. We were just on the phone with the QIO team at CMS. State survey agencies, speaking to them about the surveyor training components. So lots of different partners and partner organizations that have already gotten involved. And we want to keep building that momentum. We want people to say, so, what does the Moving Forward Coalition think about this new quality effort? Or, what does CSG think about this new policy or practice idea? We want to be important, and we want to be important because people value what we bring to the table. They value the expertise of all the people such as yourselves who are involved. Next slide. Okay, so with that, I am turning it over to, I don't know, Jasmine or Jenna, to you. Okay,
Sure,
to
to me.
Jasmine.
Thanks so much, Alice. Hello, everyone. My name is Jasmine Travers. I'm pleased to represent Committee 2 of the Moving Forward Nursing Home Quality Coalition, which we're focused on staffing and well-trained workforce. Today, I'm going to share more information about our committee and what we've been working on these past couple of months, as Alice kind of just shared the outline of the coalition in general. Next slide, please. So I co-chair the committee along with Kezia Scales, who is over at PHI, but our committee makes up a total of 16 individuals across a number of organizations such as NACA, United Health, HRSA, Consumer Voice, Center for Caregiving Advancement, Empowered Aging, academic centers like Brown University. We have 1199, so the unions. We have a nursing home resident on our committee, Jenna, who is here, who's part of Leading Age. We have a nursing home administrator, Jennifer Smeltzer, who's part of Marquis Companies, a director of CNA at Redstone, who is Deanna, and then Michelle, who is with the state of Texas. So a number of individuals that make up a very strong group that provide a lot of expertise to the work that we are pursuing. Next slide, please. So we are focused on goal 2 of the NASEM report, which is ensure a well-prepared, empowered, and appropriately compensated workforce. And what we needed to do was choose one of the 9 recommendations from this goal to move forward. So that took about 2 or 3 months for our team to decide, what is that most important recommendation, although all the recommendations, not even just in goal 2, because I could be a little biased, but all the recommendations throughout the report need to be moved forward and think about what that looks like comprehensively and holistically. But for us, just taking a bite of one of the recommendations and thinking about its feasibility, its success, its ability for success, its ability for it to be scaled up, and its ability to maintain equity, for example. So with that, we came up with, next slide, please, recommendation 2A of the report that we wanted to move forward, which is ensure competitive wages and benefits, including health insurance, childcare, and sick pay, to recruit and retain all types of full and part-time nursing home staff. So our committee recognized that wages and benefits are very minimal for nursing home workers when thinking about the other types of work that they could be participating in, or other disciplines that get paid more, or even other settings. So acknowledging that the wage needs to be at a place that is competitive, so that we don't have so many of our workers experiencing inequities in pay because of these societal and systemic inequities that exist. And particularly for our committee, we are focusing on the direct care workforce, so specifically certified nursing assistants when thinking about ensuring competitive wages and benefits, but at the same time acknowledging that this needs to be done across the board, but wanted to take a small bite. So what I'll do is just present some of the approaches that we were considering when thinking about this recommendation. What does it look like to move this recommendation forward? So our next step after identifying the recommendation is saying, what approach is going to make the most sense? Who do we have stakeholders who are going to help move this recommendation forward? What do we need? A number of factors that goes into that. What does finances look like? How do we actually increase wages and benefits? What's already been done out there? So I will present some of the approaches that we have been considering as a committee, but during the Q&A session, would love to hear anything else that you all may be doing in your states, or any reactions to what I will share. So next slide, please. So our committee came up with 3 approaches that we wanted to dig deeper in. So the first approach was a resource guide. And this resource guide is actually very similar to, or a similar idea that the National Long-Term Care Workforce here within the CSG has been preparing with regards to living place or platform of some sort where states and other stakeholders could come to this site and see other initiatives that states and other entities have actually put forward related to workforce and improving the workforce. So that's something that we wanted to, we're interested in creating. The second is leveraging quality incentive payment programs. And we'll talk a little bit more about what that looks like, but really incentivizing states for addressing staffing metrics and workforce metrics, for example. And then the third one is workforce development programs, where this focuses on different ways that we can just build the leadership and the career advancement of nursing home workers. And in our case, our specific focus, CNAs. So next slide, please. So here is, so the QIPs, the quality incentive programs, which also have been termed the value-based purchasing programs. And just going to give you an overview of this. Again, they're Medicaid payment programs with quality or performance measures and incentives if specific benchmarks are met. And this is on the state level. So it is variable in which states are focusing on. So there are 25 states with value-based payment programs, but there are only 16 states that we've identified with staffing measures. So the metrics can vary. Metrics that we have seen have been focused on retention, turnover, hours per resident per day, so staffing hours within the nursing homes, but not a big focus on wages. And that's where we kind of really want to infiltrate a bit and see, can we get wages tied to these incentives as well, so that we can increase those wages and benefits. Next slide, please. And so Texas has an interesting program, quality incentive payment program, which it consists of a number of components, which one of their components is workforce development. And again, not all states focus on workforce or staffing. And what they focus on is additional RN hours beyond the CMS mandate. So you get incentivized if you are providing, for example, a total of 12 hours of RN coverage on at least 90% of the days within a reporting period. And they need to have a workforce development plan in place The challenges of this program is that there's not a specific focus on CNAs, it's focused on RNs, not looking at staffing metrics such as turnover and retention, and it's self-directed, this program. Next slide, please. Then another program that's in place is within California, this workforce quality incentive program is pretty interesting. So they have $280 million that goes towards their quality incentive program in general, and 50% of those funds go to workforce. So you see how much California is really prioritizing workforce. And I think that's one of the biggest things. It's just kind of directing a priority towards workforce and saying, let's put our monies towards that. So you just see the percentage here at the top, but primarily they're focused on staffing hours and turnover as their metrics. So thinking about increasing staffing hours and decreasing turnover. With that, though, you just also think about the number of initiatives that nursing homes would put in place to increase staffing hours, to hire folks, and then what helps with decreasing turnover. So essentially, wages might come into that. Sign-on bonuses, for example, might come feed into that. So kind of those like indirect effects of this type of initiative. And then next slide, please. And I'll show you a program through Illinois that does focus on wages and pay scale, and kind of ties into this apprenticeship model as well with this quality incentive payment. So they have this multifaceted incentive program focused on staffing, focused on pay, focused on career development. And what Illinois has done is that they've increased the base Medicaid reimbursement so that Illinois can increase their staffing. So we saw, states that have said, oh, you need to have a certain percentage of your funding going towards staffing, but not really a lot of funds that actually supports increasing that staffing, where the state of Illinois is putting those funds there to increase those staffing for a couple of months. And then they are putting quality incentive payments towards not just quality care metrics, but the nursing staff level, and then CNA pay scale. So next slide, please. So we'll just take a look at that. So they're putting towards $350 million towards the staff level incentive payment. And what they're doing is tying the staff level to resident acuity. So adjusting staffing hours by resident acuity. So not just staffing levels. And then what they're doing also is doing the CNA pay scale subsidy, where Medicaid is paying the Medicaid share of the pay increases. So for example, if a facility has 60%, and we'll just, you'll see right there in that right box, if a facility has 60% Medicaid patients or residents, Medicaid will pay 60 cents of every dollar of the pay increase. And what the pay increase consists of is an additional $1 an hour per year of experience, up to $6.50, so 6+ years, and or promotions for $1.50 an hour, which we hear a lot of complaints and issues around CNAs making about the same amount of money that they're making from 10 years ago, for example. So that fixes that problem, or being just very close in that ballpark. And then the promotions are really associated with different career and leadership opportunities within the CNA roles. So just one click, please, Sean. So right here, a CNA, if they were in any of these types of positions, for example, an advanced nursing, if they have had advanced nursing aid training, or if they were a trainer or a preceptor, for example, or a dementia specialist, they would get a promotion for $1.50 an hour being in any of these positions. Some issues just to think about, though, with this program, it's been just anecdotally, it's been very successful, but there are issues with just transparency. So one of the issues that has been discussed is that nursing facilities were knocking people back down to the base pay. So for example, $14 an hour, if that was their base pay, then they would add the subsidy. So if they were there for 3 years, then add the subsidy from that $14 to now get $17, but if they were at $16 originally and they should have been getting $19, they would have only been getting $17 because they're back down to that base pay. So that's an issue. And then just thinking about the percentage of Medicaid residents, if you have a lower percentage of Medicaid residents, then you get fewer dollars to support initiatives like this. But if you had all Medicaid residents, it's almost like free money. And then next slide. So just thinking about, just next slide, please, Sean. So just thinking about some challenges and opportunities to consider. So the Medicaid structure, just like I shared, it's kind of like this idea of high performers versus low performers, where a lot of monies is rightfully so going towards lower performers or people who are nursing homes that have higher Medicaid residents. But then thinking about support for nursing homes in general could be both a challenge and an opportunity. Then different state policies and focus. So you see not very many states are focused on workforce in general. And then even within workforce, just a number of different focus between staffing hours and turnover and pay. And the stakeholder engagement, how do we get more people involved? And then thinking about scaling this up on a wider level. So more states being involved as well in these types of initiatives. And then just looking forward to additional discussion. We can go to the next slide and I'll hand it over to Jenna.
Hi, thanks, Jasmine. So again, I'm Jenna Kellerman. I have the privilege of working with Jasmine and with Alice, and I'm on the goal number 2 group, so workforce, and we're specifically zeroing in on wages. We've had some really great conversations in that group, and what I'm really appreciating is how focused it is on action and what we can do now, what we can do today, because this workforce crisis is so huge and so deep within the systems in our country that you can suffer analysis paralysis. And how do you even get started? What can we actually do to make an impact? So that's what this group has done a really great job of, looking at what we can actually do, what's out there, what's working now, what can we replicate, what can we try, what can we pilot or get going. And so what I want to do is just take a little bit, kind of a step back, maybe a 10,000 foot level look at workforce, and think about some of the opportunities that are out there and what we're seeing going on around the country as well. So just as a little bit of background, we know that we need to fill 7.9 million direct care worker positions between the years of 2020 and 2030. That data comes from PHI. PHI produces a lot of really fantastic research on the direct care workforce. And that number, that 7.9 million number, comes from both turnover and new positions that we know we will need to be added to cover the increase in demand that will happen with the demographic shift and just more aging people who will need care. So it's the mix of turnover and new positions. So we know we need to look at it from 2 perspectives. We need to build the pipeline. We need to have really strong systems to get people in the pipeline for careers in our field, to have reliable numbers of people entering our field. And then we also need to be able to keep them once they're here. And we have challenges with that. We have particularly high turnover in our field. And so we need to address from both perspectives. So on this first slide, I'm really focusing on the pipeline building efforts. And there are a lot of exciting opportunities around the country. Some are organization or foundation funded, others are state funded, but I think they all have opportunities for state supported efforts or policy efforts. One of those examples is apprenticeship. We're seeing a lot of interest in this area, both from providers and from states. There are some formal registered apprenticeship programs, but also some that aren't necessarily registered apprenticeship, but they are really formal career pathways with a heavy focus on skills training and support and career progression. One example of this is SkillSpring, which is a program out of the New Jewish Home in New York, although it's expanding to a couple of other states now. And they go into under-resourced schools and work with the schools and work with students in those schools who have a dream of pursuing careers in healthcare. And they've found a lot of success. They have incredible data from that program on working with students on getting them into college, on college graduation rates. They've made a serious impact on the schools in their area while also building the healthcare workforce. They have 3 different programs there. They have one that's for high school students. They have one that's for young adults who are between the ages of 19 and 24, I believe. And then they also have what they call an alumni program. So anyone who's graduated from the high school program or the young adult program can go into this kind of 3rd level where they receive additional and ongoing career support. But it's a fantastic program. It's got really formal career pathways. They have experience in long-term care. They get a lot of hands-on support. They have paid internships. They get scholarship money. They get free certifications. So whether it's nursing assistant, home health aide, they have SAT prep. So all different kinds of academic tutoring opportunities and things as well. Another example would be a program that's still in development, but should be launching in DC soon. And it's the Geriatric Career Builders Registered Apprenticeship Program. That one is funded by GW's Rodham Institute. And so similar concept of creating a registered apprenticeship program for direct care workers. These programs are out there. They're replicable. Some are early on in beginning stages. Some have been around a long time with great data to support. And the thing about apprenticeship programs is that not only does it focus on building the skill, but it also addresses a serious challenge we have in our sector, which is not enough nurse educators. Our schools are suffering because we don't have nurses and instructors to teach these courses. So apprenticeship programs can help us from both sides in terms of getting people trained in quality ways, but also finding classes or courses for them to take to get the training. So I think we have really exciting opportunities within the area of apprenticeship. Another one I want to highlight is AmeriCorps. And this is a really fun opportunity because just last year, there was a new public health AmeriCorps that launched. And so prior to that, really, we didn't have opportunities to bring AmeriCorps service members into healthcare. So this was a great ARPA funded opportunity for us. And actually in Kentucky, so Sean, where you are, Kentucky utilized these funds. They built an AmeriCorps program in long-term care settings. And that's been a really successful program. They've got lots of service members, mostly high school students who are working now in long-term care, beginning their careers with us. And we have applied for, and fingers crossed, we'll receive funding to expand this to 3 additional states. And then ideally, of course, more in the future. But another really great program that I think we could use some support and kind of rally the troops around getting more pipelines built into our field. And if you, just for the sake of time, if you want to switch to the next slide, I'll just touch a little bit on staff retention and organizational culture. We, in addition to building pipelines, we need to keep people in our field. We have really high turnover, and there's a couple of different reasons for that. One is it's a really stressful and high burnout career. Part of that has been exacerbated by COVID, of course. And so there are definitely a lot of initiatives that we need to uplift staff, to empower staff, to address the mental health concerns that we'll see in staff as PTSD, honestly, becomes an issue in our field post-COVID. Another issue, and Jasmine touched on this, is the pay issue, right? The wages issue. And there's some really exciting work going on in Virginia regarding the benefits cliff. And we know that staff being paid the wages that they are paid in our field, they hit these benefits cliffs. So every little bit more they make, it ends up impacting the benefits that they receive, right? And so it ends up being a net loss. So promotions or wage increases can actually hurt staff in our field. And so it's a precarious situation. And the work that they're doing in Virginia is really taking a look at, okay, where exactly do those cliffs hit? How can employers rally around their staff in order to get them the promotions and wage increases they need without hurting them? You know, what other supports can we add to keep them whole, keep them getting promoted throughout our field? And I think that's some really important work. That's some really important work across every state that needs to happen. If we are going to uplift people out of the wage situation we're in, we need to account for the benefits cliff issues and offer those wraparound supports. We can build those wraparound supports into the employer benefit packages that are offered. And so that will be a partnership that needs to take place between the states and employers in order to accomplish that. And I know we want to leave plenty of time for discussion. So the last thing I'll just quick plug is the need for workforce data. We really don't have great national workforce data on in long-term care specifically. PHI produces a lot of fantastic research. We have a lot of what we know is from pilots, from small samples, from one-time research that gets funded. And what we don't have is a really reliable national set of data around turnover, retention, those types of numbers. And that is really necessary to be able to figure out what is going on in our organizations, what do we need to project for the future, and how do we know if our efforts are really making a difference? There are some great initiatives going on in specific states. For example, I know Colorado and Minnesota both are embarking upon some good data collection initiatives at the state level, but there's definitely room here as well. So with that, I want to make sure there's enough time for discussion and questions. Alice or Jasmine, is there anything else you want to add, or are we opening it up?
I'm just gonna go to the next slide, and Alice, you definitely like jump in. Thanks so much, Jenna, for showing us that. So I would say kind of with that and kind of an ask is, what would move stakeholders in your state to adopt pro-workforce policies, considering what I shared, what Jenna shared, things that Alice has shared and thrown in the chat as well. And then what other policy options should we consider that we didn't present today or discuss, but it has been very successful in your states? And Alice, is there anything else you want to add?
No, that's perfect. What you said was great. Love to hear the discussion.
Great. Well, thanks to all three of you. And we will open up here to questions, or if you want to respond to one of these questions, please either you can raise your hand and we can come around and unmute you and have you speak, or you can enter a question in the chat. My colleagues Asia and Trey are going to help me monitor things in there and look around for any questions that are coming up. Have we seen anybody? I think we have a hand raised there. Clarissa Freeman from Pennsylvania.
Hi, can you hear me?
Yes.
Good afternoon. Thank you so much for this presentation. So Senator Haywood, Senator in Pennsylvania, and he has been was on the task force last year and very much engaged in looking at the benefits cliff. And one of the things that we did last year, he helped advocate for. We know childcare is a very important piece of, as you mentioned, I know you mentioned Virginia, my home state. They were working on some things, but we were able to get $25 million added to our fiscal code to allow for families who would normally lose their child care subsidy at the 235% FPL. Those who were already enrolled could make up to the 300%. And so basically last year, and the numbers probably have changed slightly, last year a family of three could make up to $69,000 in Pennsylvania and still receive the child care subsidy. So, and we, he's advocating, we're hoping it is in the governor's proposed budget this year. And Pennsylvania is unique, but in terms of being a full-time legislature, but we hope that that continues beyond, of course, this year. But that is one of the things that we are looking to, and one of the ways to address it.
Thank you for those comments. One of the other initiatives going on that you may know about in Pennsylvania specifically is revisiting the Teaching Nursing Home Initiative, which is also funded by the John A. Hartford Foundation and the Jewish Healthcare Foundation in Pennsylvania. And it's brought together, three of the nursing programs, including the deans, and 4 nursing homes that are working very much on instituting age-friendly health system practices, as well as other elements that we're working on in the Moving Forward Coalition. So we work very closely together on those initiatives. So there is a lot of there's some really good innovative work in Pennsylvania. You also have Senator Bob Casey, of course, who has a whole policy team on nursing homes. And I think it's great. So, anywhere that there are legislators who express interest or, who are important, they're on important committees. And we'd like to make sure that we can educate and advocate. We do not lobby at all. We're not permitted to under our grant, but we do educate and we do advocate and talk about the issues. So, any times we can do that and bring more knowledge forward is part of what we want to do.
And Clarissa, I just want to thank you for what you shared, just because thinking about increasing wages, and this has been something that has come up previously, because sometimes with that increase in wages, it does not allow a person to qualify for benefits that they once qualified for. And you talked about the childcare benefits. So that's something that we need to continue to think about as we're kind of looking to work to increase wages as well. And then something that just came out, I think last week, was the executive order by the Biden administration that we didn't talk about here in this presentation, but something, hopefully to come with regards to benefits and improving the quality of the workforce environment for caregivers. And one of the things was also in that was childcare, I believe, too. So that would be really a positive way forward as well.
Yeah, I'll just mention too, the benefits cliff calculator, which is really an excellent tool that drills down to the county level. So an individual can go in and enter their family structure, whether they're partnered or not, kids or not, number of kids, their wages, their spouse's wages, and then populate in all of the benefits that they receive. And then they can start predicting out, if I get this raise, how is it going to impact my benefits? And that's just one really great tool that's out there. Not that it's going to change and get us to pay people more, but it will at least get us to address the now situation that staff are in as we're working on improving wages. And so I really appreciate that comment about the increase in childcare subsidy, because I think that's one good example that can be shared to other states on increasing that. And I also want to address, I know in the chat, there's a comment here about connecting online courses with clinicals. That's an issue, and that's one of those issues that is different state to state and different regulations on, can you use online training and can you not use online training? How many hours does it need to be? That's one of the kind of frustrating factors of our training and how it differs everywhere you go. Yes, there are states that are doing a really good job of connecting students taking online courses with clinicals. I will say, I don't know of any doing it with strong systems that can just turnkey be placed in another state. Right now, what I'm seeing is a lot of human resources time being put into hand matching. But there are states doing that, and I'd be happy to talk further with any individuals or to help make connections if that would be helpful.
I would love to jump in and just add to everything Jenna outlined so beautifully there, that this is a big issue, right? I mean, when we've got all this state to state variability, on the one hand, if you're working at a state level, it's good because you get to sort of manage and control things in your state and you know everybody there, the locals and all that. So there's good things about it for sure. But it's a challenge when we've got such a limited workforce and then there's just so many different regulations. It confuses people and they can't figure out the system and there's barriers. So there could be some benefit to streamlining and getting around some of these state to state issues and saying, at the federal level, could we have at least some guidelines that would work for all the states, not add bureaucracy, not add, malfunction, but to actually streamline and make the system better for people who want to get into this kind of work, want to work in nursing homes. I think that it's something to consider, and I'd love to know what other people think, but we're really being hamstrung right now in some ways by the state to state issues. And Jenna, I know you've done some work on this. Jasmine, you probably have too. So yeah, and getting in touch with us would be great.
Melissa, another resource is the nurse practitioner organizations. They will have an online directory of nurse practitioners who are willing to be preceptors and sites. So that's something to consider on national level, but on a state level as well, as they have state-based sites. Sure.
Great. Additional questions for these folks? I think I can't see the chat. So Asia, if there's anything in there, can you bring it to our attention? I think it's just people reaching out to each other there, but
Yeah, I think we have captured all the questions in the chat. Sorry, Trey had to unmute me.
it's okay. So as we wait for any additional questions here, yeah, I had the opportunity to give a presentation about our project to Jasmine's committee and Jenna's committee last week, and after I babbled through my portion of the program, it was great to stick around and hear what the committee is working on, and you heard a little bit about that in terms of the three different sort of approaches that the committee is discussing, and I was curious to know, how will it be decided? Because I think I understand that only one of those is going to be selected. Is that correct? And so are there opportunities perhaps for the other two to receive some attention in the future as well?
Yeah, that's a good question, Sean. And I feel like that's the $1 million question of the week. What's going to happen? So our committee members have put a lot of work into these approaches. And what we're seeing, and kind of what you saw last week, is that they're not necessarily so separate as it might appear when, first presenting it. There's a lot of overlap in many ways, overlap in both expertise and kind of the work that's being presented. So I think while we may just go with one or maybe two of the approaches, I feel like will be lumped in like one or two of those. So there won't be any specific one fully left out. But then again, at the same time, you saw that resource development, the resource guide, that's something that you all are already doing, right? So maybe that's something that, some low-hanging fruit where we just help inform that. So it's not something that we fully take on, but we say, hey, that's something that we were interested in. And this is the information that we've already kind of gathered along the way. Let's share that with you. So I do see all of that work going somewhere and not being lost. Go ahead, Alice.
Right. No, I was just going to add to what Jasmine just said. Totally agree with all that. And, we're a coalition, which means we have partner organizations like CSG and many others. So to Jasmine's point, if we identify something that would be a great fit, or, that one of the other organizations is already working on, then we can highlight that and work with that partner organization, and maybe they'll take it on and they'll run with it. As you said, Sean, there's just all these associations and groups that are doing very similar aligned work. So that's mostly what we do is try to connect the dots and say, so who's going to work on this? How can we really, motivate and incentivize the work to continue to go forward?
And so then is the process also the same for the other committees? Do they have like sort of three approaches that they're considering?
Well, the different committees are all in slightly different places. Some of the committees have either 2 or 3 different approaches. A few of the committees have decided to work together collaboratively. So, the groups that are working on resident directed care and, goals, priorities, and preferences, the, committee that's working on that is looking at some existing practices that have evidence. There's a different committee that's working on innovative IT approaches of getting that information. And then there's a measurement committee that's looking at a concordance measure to see if we ask these things and get it into the care plan, do they actually get delivered? And then the 4th committee is looking at the surveyor surveyor piece of that. So, okay, if the nursing homes are doing it, that's great. What are the surveyors getting in their training so that they really understand person-centered care even more than what they get trained on now? So it's that kind of thing. So it's all over the place, but I would say anywhere from, 2 to 3 approaches are being considered by all the committees.
Great. And just remind folks again what the sort of timeline is for the next steps and everything.
So the committees are, as you heard from Jenna and Jasmine, working really hard on the action plans. Those are going to be submitted for us to give to the steering committee by May 26th. And then from there, we will prepare them so they hang together as a set. We'll send it to our steering committee. They'll have 2 weeks to review the action plans as a set. And then we'll have a half-day meeting of the steering committee to share any other feedback or ideas that they have. And then we're anticipating that those action plans will be posted on our website and publicly available by sometime in the middle of July.
Great. And I guess we may need to have these folks back at a certain point to talk about sort of what the final decisions were and how those move forward and everything. But we want to thank these folks for joining us. We're just about out of time here. I want to once again thank Alice, Jasmine, and Jenna. And a couple of quick notes before we go. There are their contacts if you didn't get those in the chat, and I can put you in touch with them as well. So the next meeting we have is scheduled for May 24th. That's our next network meeting. Our focus for that meeting will be the dementia care workforce. We will be joined by Diane Tai, Senior Director for the Center for the Future of Aging at the Milken Institute, which has issued recent reports on building the dementia workforce and system capacity, the projected prevalence and cost of dementia, and the roadmap for investment in dementia care. Also, Andrew Ross, Director for State Affairs at the Alzheimer's Association, will discuss the association's policy agenda and how states have addressed dementia care in recent years. We will send around a Zoom registration link soon, and we hope you will be able to join us for that. We are, as I said, working to develop our National Online Resource Center. Please send us your recent relevant bills and reports, resources, articles, and initiatives for us to include about what is going on in your states regarding the long-term care workforce. If you would like to request technical assistance services or tell us what you'd like to hear about at future meetings, please don't hesitate to reach out with your thoughts on any of that. And there is my email address. Thanks so much again for joining us today and participating in the discussion, and we will talk again soon. So long.
Thank you.
Thank you.